thinking of getting pregnant or I am pregnant, I shouldn't get vaccinated. And we'll close the poll. 90% fiction and 10% I don't know. Samir?
Absolutely right. Early in the pandemic, there was a lot of consternation. There was concern. This was a new vaccine. We didn't have a lot of data. At this point in time, and I should say early in the vaccine campaign, but at this point in time, we're well into our vaccine campaign and we have lots of data. Something that's really important for people to recognize is that we know that pregnant women don't do well when they get COVID disease. They have a higher risk of severe disease. So that's important because you're always thinking about risk benefit. The risk is much higher in pregnant women, not only to mom, but also to baby. There's about a 4 times higher chance of premature birth in pregnant women when they get COVID disease. So that's the context here, is that we already know there's a higher risk. At the same time, we now have studies showing that the vaccine mitigates that risk. You get the vaccine when you're pregnant, the risk to mom and the risk to baby gets reduced as a result of that vaccination. There's also a side benefit. Some studies show that there's passive immunity. So the baby actually gets antibodies from the mom. And there's some protection in the first few months, at least the first few months of life, as a result of those antibodies passed on from mom who was vaccinated. And that's an effect that's seen more so with vaccines than with natural infection. So vaccines seem to be more effective at protecting the fetus. The other thing is that we now have lots of women, pregnant women, who have been vaccinated. So lots made that decision before we had trial data. And so we have safety monitoring studies in several different countries that have looked at women who got the vaccine when pregnant versus those who didn't. And really no change, no difference was shown in birth outcomes for those two groups. Also, there's now a study, the biggest study I'm aware of, had looked at 40,000 pregnant women. And again, no effect on mom or on baby, no effect on preterm labor, no effect on birth abnormality. So really reassuring data. So with respect to safety of getting the vaccine when you're pregnant, I think that's quite clear now. In terms of fertility, because people also say, part of the question was thinking about getting pregnant. People are worried about their vaccine impact on fertility. Really no reason to think that there would be an impact on fertility, no biological or scientific reason to think so. But also we have studies. The biggest study I'm aware of is a study that followed 2,000 couples, looking at some couples had the male only vaccinated, some the female only, and some both vaccinated. Compared to couples who were completely unvaccinated, their chances of conceiving were exactly the same. There was even a study in women who were undergoing in vitro fertilization, and in those women who already had fertility issues, no differences in ovarian function in women who got vaccinated versus those who didn't. And for men, this becomes really important because COVID disease is actually associated with lower fertility rates, mostly because it's associated with erectile dysfunction. So there's more than 50 studies that show an association between COVID infection, COVID disease, and erectile dysfunction. So if you're worried about fertility, it's really not the vaccine that you need to worry about. It's the virus itself.